imaging is a social enterprise focusing on medical technologies. So our main goal is we go out into especially developing countries, countries with low resources, and ask ourselves, how can we make medical imaging technologies more accessible to these communities? Hard to reach communities typically in these settings are the ones that have the highest burden of various diseases and complications. So it is our role to bring them the technologies to do the disease screening properly.
Let me just ask a question that looks like an ordinary question. What is the gap that is there in imaging as a solution in sorting out healthcare challenges in Africa?
Yeah, so medical imaging is typically expensive. Medical imaging technologies, you know, X-rays, I don't know if you've ever had an X-ray or a CT or an MRI scan, these are very expensive technologies. And for tuberculosis, for example, which has a very high burden on this continent, it's recommended to get a chest X-ray. But what happens when those exact communities in those settings where TB is the highest cannot afford an X-ray, and on top of that, for medical imaging, you need a medical professional. And those are the same settings that don't have medical professionals. So that's the gap that we're addressing.
So at this event here in Nairobi, and of course there are lots of players here, what are you focusing on at this event? What are you focusing on?
Yeah, so Delft Imaging, as I just mentioned, has a big focus on tuberculosis screening. So what we've done in the past decade is bring X-ray to the communities that need it the most. So we've put X-rays in backpacks, for example, to really bring those technologies to hard-to-reach communities. And how we've addressed the gap in medical professionals, the scarcity of that, is through artificial intelligence. So using artificial intelligence combined with the technology for medical imaging to basically improve the screening of diseases. Now, we're leveraging that expertise that we've built for maternal health. And that's why we're here, because this is an event about women's health. And Baby Checker is the solution we've launched recently, and this is the first event we're presenting it at, actually.
Tell us a bit more about Baby Checker.
Yeah, Baby Checker is very exciting. So it's the same concept of using a medical imaging technology. So in the TB case, it's X-ray. In this case, it's ultrasound. And combining that with AI, artificial intelligence, to basically meet the need of the lack of ultrasound in communities where maternal health is the poorest, maternal mortality is the highest, and there's no medical professional. So AI can help with that, right? So Baby Checker is that. It combines portable ultrasound, basically an ultrasound probe that you connect to your smartphone that uses artificial intelligence to read the ultrasound images and detect complications.
Now, talking about AI, fairly
AI.
Abbreviations, really.
AI.
But I think in Africa, we are still wondering what it really is. And now the question is, what is the big opportunity around new technologies? You talked about cost. Imaging tends to be fairly expensive.
Yeah.
What is the space for new technologies to also kind of level the cost of care across this continent?
Yeah. So basically by bringing technologies that are typically very large. So an ultrasound, for example, can be up to $50,000. It's rolled on a cart through a hospital. This is not typically a device that can be in the most remote villages you can think about, right? It's not a technology that can be rolled around a community health center, and also it provides an image that community health workers are not trained to read. So AI can really bring the cost down because we are using mobile technology like smartphones, which is already cheaper than big imaging devices, and AI is reducing the need for a medical professional. Medical professionals are typically also an expensive resource. So that's how we're trying to reduce the cost as well. And then another thing AI can do is triage. So through AI, we're determining a risky case with a non-risky case, which means that some cases don't need to go to the hospital, right? If all the cases have to go to the hospital, that's very expensive for the healthcare system, because then very complex tests and examinations by doctors need to be given to all those patients. If 30% or 50% of those patients can be already determined at the community level that they're in a non-risky situation, then we're reducing how many patients need to be seen at the hospital.
Now, as we close, could you just tell us a bit about the kind of footprint around Africa where your company is? And then what kind of future plans you have for the continent as a company?
Yeah, so Delft Imaging is in 62 countries around the world. A large part of that, almost 50% of those are in Africa, sub-Saharan Africa. So we have quite a large footprint here. We have big national projects with national authorities, like in Ghana, for example, where we have national installations for TB screening. Also in Nigeria, huge projects there. With Baby Checker, we've just started. So we're starting from, not from scratch, because Delft Imaging has a good network of partners in various countries, from the government to NGOs and the private sector. But we are doing research at the moment in Sierra Leone, also running a project in Ghana. We've done a project in Ethiopia, and hopefully in Kenya later this year. Yeah.
Okay, and I think that really does it, but maybe an opportunity just to make final point.
Final point. I think a lot more attention needs to be given to social enterprises in the private sector. I think in the past decades of healthcare, we've focused a lot on NGOs, which have played a significant role in advancing a lot of different activities in healthcare. But I do believe the private sector is really just started to really pick up the pace and really make solutions more sustainable. So think more, how can these solutions be self-sustained, and how can the community adopt them and be able to be self-sufficient with these solutions? That's where the private sector can really come in and redefine how we do healthcare intervention.